Hello everybody. Thank you very much for coming online. Welcome to MPS webinars. And today's presenter is Dr. Anant Patil. So he's assistant professor in one of the medical college in Navy Mumbai. I will ask him to introduce himself and give more details about himself. And we look forward for an energetic and enthusiastic presentation. Dr. Anant, can you please take over?
Thank you so much, Dr. Shivamurthy. First of all, I would like to take the opportunity to thank Dr. Sandeep Kaushal, Dr. Shivamurthy, Dr. Pooja Roy, and special thanks to Dr. Sonali for taking efforts to make this webinar successful. And also thankful to all of you for this overwhelming response that you have shown to the webinar. I'm going to present on the basics that one should know while we write a paper. Dr. Murthy, can you have the next slide? Basically, my presentation has been broadly divided into 4 parts. One is, what are the publication types that we can write? When we select that this is what publication I want to write, what is the structure and the process that one should follow while writing the paper? And what are the basic steps that we should follow while we submitting the paper for submission for publication? And what happens in the peer review process. So that is how I will be speaking for next 45 to 50 minutes. What is the importance of publication? Now, importance of publication basically can be thought of from 2 perspectives. One is from the pharmaceutical company's point of view. And somebody has rightly said, writing or publication is an art of converting science into commerce. Meaning the pharmaceutical companies, they have a lot of products, they write papers, they communicate their messages to the prescriber or the healthcare professionals, and that's how their brand becomes big and they make revenue out of it. So it's an art of converting science into commerce. What is the benefit of publication for individual person? So for individual person, publication can help from 2 perspectives. One is to, it basically gives you credibility, it gives you recognition, it increases your visibility, and also in your professional growth, publications, they play an important role. Can you have the next slide, please? So broadly, the publications or the articles can be divided into 3 types. One is original article, second is review article, and the third is case reports. So when we say original articles, usually under original article we publish prospective studies, retrospective studies, observational studies, or even the in vitro studies. Whereas in review articles, one can write narrative reviews, which consist of editorials, commentaries on some paper which has been published, or non-systematic narrative reviews. The second type of review article could be qualitative review, which is called as qualitative systematic review. And the last one is quantitative review, which is usually we call it the meta-analysis. So meta-analysis is a quantitative review, systematic review. And finally, we also can publish case reports. So any article that we write falls under one of these categories. Next. Now, when I interacted with physicians across India, one of the challenge when I speak to physicians and ask them, why don't we publish articles, especially from the Indian perspective? One of the major challenge that we see is Indian physicians are very busy. They don't have time. That is the answer which has been given by the physicians, most of the physicians. Secondly, they say they do not know, or there is nobody to guide how papers are to be written, because this is not covered under our curriculum. And some concerns related to ethics. What are the publication ethics? So many people are not aware about the publication ethics. Next. So if somebody wants to be a medical writer, what are the skills that person should acquire? And these are the 3 broad areas where expertise would be required. One is scientific knowledge, and I'm sure everybody of us are medical people, and scientific knowledge is not an issue. So what is the major expertise that we need is to understand the publication ethics. And secondly, we need to have some skills about basics of medical writing. You don't have to be a prolific writer for writing a manuscript. Even a basic English knowledge would be enough. But there are some skills that one should acquire for writing a good manuscript. Next. Now, who are the people involved in publication? Basically, there are 4 people or 4 groups who are involved into publication. One is author. Second is the professional writer or a medical writer. If author does not have expertise to write, he might hire a professional writer or a medical writer to do writing for him. The third important person is the editor of the journal where you are going to publish your article. And once the article is submitted for publication, the peer reviewers come in picture. So basically, peer reviewers are nothing but the experts into that particular domain for which you have written an article. So these are the 4 people basically involved in publication. Next, who can be an author? So for being an author, the person should have significant contribution in conceptualizing the paper, designing of the paper. He should have been involved in the analysis and interpretation of the data. He should have significantly given his time and effort for drafting and revising the article. He should have given intellectual inputs. And finally, he should be the one who should approve the manuscript. If any person who qualifies this criteria, he can be an author. So there are 2 basic concepts that one needs to understand about the authorships. There are 2 types of author. One is called as the ghost author, and second is called as the guest author. So what I mean by guest author is the person has not contributed significantly in writing paper or conceptualizing the paper, but his name appears on the manuscript. That is called as the guest author. And who is the ghost author? On the contrary, any person who has significantly contributed to the medical writing or the paper writing, but his name does not feature as an author. So he's a ghost author, and second one is the guest author. Ideally, both things should not be done, because ideally any person who has significantly contributed, he should be recognized as an author. Suppose somebody has given a significant amount of time, and so rather author, he should be included as an author, or maybe his name should be acknowledged in the acknowledgement section of the article. Next. Now, what are the ethical issues that one should be aware of when we're writing the manuscript? The journal and the editor, as well as the peer reviewers, would be concerned about originality of the data. So is this data original, or have we manipulated this data? So this is one of the ethical concerns. The second concern is duplicate publication, which is also called as the redundant publication. I'll come to that, what is redundant publication. The third ethical issue for medical writing is plagiarism. There are also some statistical issues which could be ethically incorrect, or what is the method of statistic that you have applied, whether the meaning is same, or are there significant issues related to statistics. Another important concern related to ethics is when we use images, pictures, diagrams, or tables which have been published before. So ideally it is must that we should have permission to reproduce those images or the pictures or the diagrams or the tables. And finally, another ethical issue would be citation. The reference that we cite or the bibliography that we present should be published somewhere, or you should have adequate reference for citing that particular reference. So for understanding these ethical issues, there's a committee called as Committee on Publication Ethics, COPE. And this committee provides the leadership for understanding ethical issues related to publication. So this committee helps the journals and the editors of the journals to give them the guidance on what could be the ethical issues and how the quality of the articles can be improved on the ethical aspects. Next. Now coming to what is meaning of redundant publication. So basically redundant publication means you are publishing a work or a paper which has already been published somewhere before, or you're taking substantial amount or the substantial section from the paper which has been already published more than once, either in the same language or even in another language, and you're not acknowledging the source from where this paper has been taken, nor you're cross-referencing it, or you are not giving any justification why this paper has been republished. So if that is the case, then it becomes a redundant publication. So if the paper is already published and you are taking significant amount of portion and republishing it, this is unethical and we should not do it. Next. Now coming to plagiarism. What is plagiarism? Plagiarism is basically an attempt which is done deliberately to gain an advantage by presenting somebody else's work, showing that it is your own work. So it is also substantial duplication for somebody else's work without acknowledging the original source. And now journals, and there are some free available software that we can use for checking the plagiarism. One of them is DupliChecker. So DupliChecker, and the journals have their own plagiarism checks, or they have their own software. So plagiarism has been very seriously been taken as one of the ethical concerns in the medical publication, or any kind of publication, not only medical but anywhere in the literature. Next. Trial registration is another important aspect that one should be aware of, because if you want to publish your paper in one of the good journals, good journal meaning the journal which are peer reviewed, or the journals who are members of ICMJE, that is International Committee of Medical Journals Editors. If that journal is a part of ICMJE, they will ask you for the trial registration. And the trial could be registered in any one of the registries, not necessarily that one has to be registered in a specific registry. You can register in any registry. There are several registries across the globe. So we have the Australian New Zealand Clinical Trial Registry. In the US, we have the clinicaltrials.gov. Then for Europe, you have Utracity database. Then for international standard for randomized control trial, we have ISRCTN. Then also there is the ICTRP. And for our own country, for India, we have Clinical Trial Registry of India. So we can register this trial in any of the register. And if we register, the acceptance of that article or registration, acceptance of article rate would be improved. In fact, many of the times, if you not register the trial and when you try to submit online, one of the checklist is that you should have the trial registration number. And many of the journals, if there is no registration number, they would not allow you to proceed with the submission. Next. Now, when we report or when you write a manuscript, and I'm specifically talking about the manuscript of the original article, I'm not talking about the review articles or the commentaries or the editorials. So when we want to report or write a paper which is based on the randomized control trial, we need to follow consort statement. So consort statement is nothing but the consolidated standards of reporting trials. If we are reporting systematic review, if you are writing systematic review of randomized control trials, then we can have, we have to follow PRISMA statement. And when we are presenting observational studies, then we need to follow the STROPE statement. So basically these statements are nothing but what are the good practices for reporting that particular trial or results of that particular study. And they have the checklist. So you can actually take the checklist and see if every point has been covered. Especially for consort statement, when we write randomized control trials, they are more concerned about what is the flow chart. Because in randomized control trial, we have people who are screened, then there are people who are randomized, then there are people who are given treatment, but they are not completed the trial. And then we finally have the people who are analyzed. So there could be significant variation in the numbers of the people who are screened and who are the people who are actually analyzed for the efficacy and safety. So this flow diagram becomes very important as far as the consort statement is concerned. And there are flow diagrams available in the checklist. Next. So coming to the second part of my presentation, what is the structure and what is the process that one should follow while writing a manuscript? And again, I'm talking about manuscript only related to the original articles, not the review articles. We can have another session on the review articles, but this is, this presentation is focused on the reporting of clinical trials. So I'll talk about what is the structure for reporting clinical trials. Next. So basically the structure of clinical trial can be broadly categorized into these aspects. One is title of the article. After that is the abstract. Then comes is the introduction, and I will take every aspect in detail in the subsequent slides. So broadly, in introduction, we write why we don't want to write this paper. So we give the background of that particular disease area. Then we find out what is the limitation in that particular therapy or whatever we have studied, what we have done. Once we understand that limitation, how is our trial going to overcome or help to overcome that limitation? That is what we write in the introduction. So we justify that what was the reason for conducting this trial in the introduction. And finally, after the introduction, we write an objective. What was the objective of this particular study? So basically the introduction section answers why part of the publication. Whereas the methods, after the introduction, we write methods. And what method addresses is that what you did in this clinical trial, when you did. So the reviewers also wish to know when was the trial conducted, where was it conducted, and how it was conducted. So the materials and method will basically cover up the answer to these 4 questions. In the results, we write what, meaning if you have done the study, what are your results? So basically we write the results, and in the discussion, so what? These are your results. How are they clinically important? What is the relevance of your results? Are they going to change the clinical practice? Are they going to help the clinician to improvise the clinical pattern, or are they going to improvise your outcome? So what is the meaning of your results? That has to be discussed in the discussion part. And finally, acknowledgement and the references. Next. So broadly, if I want to understand or I want to remember the structure of manuscript, I remember the acronym called as IMRAD. So I stands for introduction, M for materials and methods, R for results, and D for discussion. Next. Now, what is an abstract? We all know abstract is nothing but the concise document. The people who have worked in the industry or working in the industry, they would know the statistical output and the clinical trial report. The clinical trial report goes in hundreds of pages, and the manuscript is of 5 to 7 pages. And abstract is only about 200 to 250 pages. So from 200 pages or 150 pages, we make the document so concise into 250 words. So this is one of the most difficult tasks of the manuscript writing. So we need to write an abstract appropriately. And we all know making simple things complicated is very easy, but making complicated things into simpler things is very difficult. And that's why writing abstract is more difficult than writing the main paper. So what we need to write in the abstract is that we only have to present our major elements. Abstract can be given for journal submission, or most of the times we write abstract for the conference submission. So there are different, again, guidelines for writing abstract for the conference submission and the abstract for the journal submission. Next. So basically the abstracts are of two types. One is called as the indicative abstract, or also called as the descriptive abstract. And second is called as the informative abstract or comprehensive abstract. So I will take you through what is the meaning of indicative abstract and the informative abstract. So can we have next slide? So indicative abstract, on your right side on this slide, you see the indicative abstract, meaning these are paragraph forms. And indicative abstracts do not present the summary of the facts or the conclusions. The indicative abstracts are basically used for descriptive papers, especially for the review articles. So when we are writing review articles, we write indicative abstract. But when we write the reports of clinical trials, we don't use indicative abstract. We use the other type of abstract, which is informative type of abstract. So indicative abstract is used only for the review articles. Next. This is what I had shared a few days back on our WhatsApp group. So osteoporosis in patients with type 2 diabetes. Some of you might have worked on this. So what is this? This abstract is not relevant for the research article. This looks like an abstract which is for a review article. So this abstract has to be broken down into subsequent field, like what was the background, what is the objective, what are the material methods, what is the result, and what is the conclusion. So if you divide this abstract into that particular thing, then it fits into the category for the informative abstract, and which could be relevant for submission to the journals for clinical trial results. Next. So informative abstract, if you now correlate the previous slide with this slide, the previous slide had given synopsis of the work. So what the authors did in the prior trial was they looked at what is the prevalence of osteoporosis in patients with type 2 diabetes mellitus. Now, if you go back again to the title of the article in the previous slide, osteoporosis in type 2 diabetes. Now, I do not, if I only read the title of this article, I do not understand whether it's a review article or this is the clinical trial results. So title can be modified. I could have written that title as prevalence of osteoporosis in type 2 diabetes, results of a cross-sectional study from a tertiary care hospital or from a city or from a state or from a country. So that gives me a clear picture. Reading at this title, the author would be, the reader would be interested whether should I read the complete paper or should I ignore it, because if I'm only looking for the clinical trial result, and if I come across this title, prevalence of osteoporosis in type 2 diabetes mellitus, I might ignore this paper and I would not include in my meta-analysis or systematic review, because the title says, our title makes me think that this is a systematic, this could be a review article and not the original article. So the person who has done significant work, because he has not written the title correctly, his paper might be missed from the systematic reviews or the meta-analysis, and then your citation gets missed. So writing title is also very important. So the informative abstracts, they are used for documenting or reporting experimental findings for all trials, whether it is a prospective, retrospective, or in vitro trial. Informative abstract can also be done for systematic reviews as well as the meta-analysis. Next. Title should be accurate, informative, and complete as far as possible. Now, when I go back to the exercise that we just had, osteoporosis in patients with type 2 diabetes mellitus. that title is not informative, does not give me information what this is about. Is this a review? Is this a study? So it should be complete as far as possible, so that reading at the title only, the reader gets interest in going through your complete paper, or he ignores it based only on the title. In the abstract, we write the background, and in the background, we just give the context of the study question, because in the abstract, we have a very short limit of word counts, maybe 200 or 250 words. So you cannot give a half a page of background. It should be just 1 or 2 lines of a context why you wanted to do the study. In the aims, you need to give clear objectives, and objectives should be precise. If you want to extend the objective, you can do that in the main paper, but not in the abstract. So be precise in the abstract. Under the method section, we write design. What was the study design done? What was the settings? What kind of subjects, patients or the participants that were involved in the study? What was the intervention given? Only write main outcomes of the result. Do not give the minor outcomes, because again, this is a very short document, and if the reader is interested, he might go back into the full paper. So in the abstract, only write the main outcome. And when we write outcomes, try to give the numbers and the figures so that the author, the reader gets an idea whether the results are really significant and he should read the complete article. Because if I only write there is a significant difference between the control and the study population, so I do not know how many patients were involved, I do not know what is the p-value, I do not know what is the confidence interval. So if you give that, then the reader becomes more interested. He goes back to your original, the full text articles, and looks at what is the real value and whether it would be important in the clinical practice. So try to give the numbers in the abstract. Don't only give sentences in the the result section. When we write results, focus on the primary outcome and not on the secondary outcomes, because primary outcome is the one where the sample size will be calculated based on that primary outcome. The reader would be more interested to look at what is the primary outcome rather than the secondary outcome or the minor outcomes. In the adverse effects also, only give minor ones, the major side effects, not the minor adverse effects. If at all there are dropout, we might present those dropouts in the result section. And conclusion should be clinically relevant. Include both positive findings as well as negative findings. Many times what happens is we try to only focus the positive findings and we try to kind of hide the negative findings. So that gives a little bad impression, because you are trying to hide the negative findings. So be transparent in the abstract so that the reader gets idea whether he should go to a complete paper or not. What is most important in the abstract is to look at the keywords. And we should write the most relevant keywords when we submit the abstract, because what is going to happen is once your paper is published and the third person wants to retrieve the article related to that particular area, keywords are the main factors that are going to fetch your article from the large databases which are available online. And to get what is most relevant and what is more commonly searched by the people in the web, you can use this mesh terminologies, which is on the PubMed page. So mesh on demand, there is a tab on the PubMed, mesh demands. So suppose I want to get what is the mesh term for depression, for example. So I put depression and I click that mesh terminology. So PubMed will give me the mesh terminologies what are relevant for depression. It could be depressive disorder, it could be depression. So you will select what is more appropriate for your study and you put the keyword as a mesh terminology. Next, what should be avoided in abstract? In the previous slide, we discussed what should be written, and now here what should not be written. We try to avoid the title in the abstract's objective. Many times what we see is that whatever is the title of the article, we write the same title as an objective of the paper. Now unnecessarily we are wasting the number of words, because abstract is very short space, 250 words, and if you use 15 words, what already you have talked about in the title, it becomes repetition. So try to avoid repetition of title in the abstract's objective. Try to give as much as different information so that reader becomes more gets broader idea of your paper. In the abstract, do not use undefined abbreviations. Undefined abbreviations means those which are not internationally accepted, or if you're using abbreviation for the first time, try to expand in the bracket, write the abbreviation. Do not just give abbreviation and don't. So try to expand at the first presentation. Another important thing is in abstract, we should not give an information which is not there in the main paper. I have seen abstract where you talk something in the abstract, but when you actually go through the whole paper, what you have mentioned in the abstract is not present in the main paper. So the reader is lost because you have misguided the reader. You written the abstract so that the reader thinks that this particular thing could have been expanded in the main article, but when I read the complete article, that information is missing in the main paper. So do not provide something which is not there in the abstract, I mean in the main paper. So do not include that part in the abstract. Next is, do not make unsubstantiated conclusions, which means you have written the abstract, you have written the objective, material methods and the results, and you are making a conclusion which is not based on the abstract what you have written. You are making a conclusion which is unrelated to these findings. So don't do that. So based on the result section, whatever results you have found, try to correlate your conclusion with the results only, and do not give the unsubstantiated conclusion. References usually are not required for abstract. They are unless you are submitting for the conference, and conference guidelines specifically ask for the references. Do not provide the references in the manuscript abstract. Next, coming to the introduction. So after the abstract, we have the introduction section. In the introduction section, we need to clearly articulate the research question which is addressed by the study. Now, I have seen papers where the introduction goes up to 2 pages and 3 pages, not required, because that could go in the review article. If you're writing a review article, 2-3 pages of introduction is okay. But here you're writing a manuscript which is based on the clinical trial result. So introduction should be short, crisp, and it should address the research question which is going to be addressed by your study. In the introduction, we should focus and write what is the importance of research question, what is the hypothesis that we have taken, and what are we going to do in this particular article. So that is more important rather than writing a review in the introduction. Introduction should be straightforward without excessive wordiness. That's what I just told you. Do not give too many words, and do not keep on just expanding the introduction for the sake of writing 2 or 3 pages. Introduction should be such interesting that it should motivate the reader to read your paper and to actually look for results. So introduction should be such interesting that he immediately should want to go back to your results and look at the results. What are the results of this study? Next. So this is again a very broad guideline how one can write an introduction. Say for example, I want to write a paper where I have done a survey, and I try to find out that a physician population, and I think that physicians are not practicing guidelines on a particular therapy, and in this particular area I have chosen peripheral neuropathy, and I did a survey. For example, hypothetically, I did a survey to understand what is the guideline adherence of the physicians in management of peripheral neuropathy. So how do I write introduction? I write a general problem, then I go to a specific problem, and then I go to how my study is going to address this problem. So just to relate this introduction to the concept what I just hypothetical topic that I discussed. So in this case, the general problem is peripheral neuropathy. 3-4 lines about peripheral neuropathy, talking about epidemiology, incidence, prevalence, what is prevalence in your own country, Indian country, or any country where you are writing the paper for, what are the causes of pain for peripheral neuropathy. Then come to specific problem. And here the specific problem is, because there are multiple causes and there are multiple reasons for peripheral neuropathy, and diabetic being one of the most common reason for peripheral neuropathy, and there are multiple guidelines available. But unfortunately, I think that the guidelines are not been adhered by the physicians. So this is the specific problem that is there in this population. Now, how is my study going to address this problem? So what I'm going to do is, I know that the guidelines are there, but physicians are not adhering to this. So I want to find out what are the reasons why physicians are not adhering to these guidelines. And once I find out the reasons, I will report those reasons. And in the discussion section, I might give some solutions that these are the reasons why physicians are, this is fact, so many physicians are not finding, adhering to guidelines. These are the reasons why these physicians are not been adhering to guidelines. And this could be the solution to improve this problem. So this is how introduction can be written. Next. In the materials and method, I write about everything. The 4 questions that we discussed in the one of the slides. What we did, where did we do, when we performed the study, and how the study was performed. So that covers sample selection. So if I included physicians, who were the physicians, what was the inclusion criteria, what is the exclusion criteria, was ethical permission taken, very important, especially for clinical trial results when we are talking about ethical considerations are must. Then what is my pre-specified primary outcome, what is secondary outcome? Be very clear that what is your primary outcome, because the reader is more interested in the primary outcome. We have seen that when paper is written, we discuss more on the secondary outcome, and we give very little space for primary outcome because the findings may not be that significant in your paper. But clearly state that what is your primary outcome and secondary outcome. What are the analytical principles that have been used in this particular study? What methods of statistical analysis did you use? So that has to go into materials and methods. Next. In the materials and methods, sometimes you might want to use figure. And in the figure, you want to show that what was your study design, how patients were selected, whether you use any algorithm. So that can go as a part of methods. In the method section, we also need to describe if there is an unusual statistical methodology which you have used. If that has been used, why you selected this statistical method compared to other ones which are used by other people. Nowadays, very commonly, the reviewers or the journals, they ask what is the software that has been used for analyzing this data. So we need to provide the version of that computer software, the manufacturer's address, and the country from where the software is purchased. So those details are also required when you write the materials and method. What was the method of subject recruitment? And if at all you have checked the compliance of the subjects in this particular study, so how was the compliance measured? That also has to be written in the materials and methods. Next. Going to the result section, this is another important section of the reporting of manuscripts, especially the clinical trials. Now, one principle that one should remember is here in the result section, we don't only have to describe the results, do not interpret the results. So whatever has been written or whatever results you have seen, you just describe those results and do not interpret the data. What do I mean? Interpretation is that, say for example, you found that in a study 70% male were there and 30% female were there. So just write there were 70% male and 30% female, or say the male were predominant. But when you write discussion section, there you interpret what could be the reason of the 70% male. So was your sample biased, or this prevalence is more common in male population? Do not interpret in the result section, interpret that whole into the discussion section. Now when we present the results, there are two methods by which one can present the results. One is simply presenting the data chronologically, meaning whatever we discuss in the primary objective, secondary objective, and the evaluation parameters. So we keep on presenting the same data what we discuss in the materials and method in a chronological order. So that is one method of reporting the results of clinical trial. The second method of reporting results of the clinical trial is to give order of importance. So what you feel is the most important aspect of your clinical trial. What are the most important results of your clinical trial? So start with the most important result and then go into the lower importance or the lower rank of importance. Clearly distinguish, as I said, between the primary and the efficacy results, and don't forget to report primary objective or the primary result first and then the secondary result, not vice versa. Again, results should also be as concise as possible. As I said, the statistical report could be 100 pages, but your manuscript is just 10 pages or maybe 6 or 7 pages. So results should also be as concise as possible. Next. In the results, we report population characteristics, response rate, discontinuation rate, missing data, protocol deviations. Those all have to go into the result section, and then interpretation of why there was a missing data, how you handle this missing data, what was the protocol deviation. So the discussion of those things should go into the discussion part, not in the result section. One of the common problem or the mistake that we do while writing a paper is when specifically we're writing the numeric numbers. Sometimes we just give percentages and we do not give the numeric numbers. So always try to give numbers as well as the percentages. Say for example, there are 10 people in a study and you say 80% people did not satisfy the criteria. So 80% means just 8 people. So if you only give 80%, I might feel that, oh, that number is very significant. But when you go back to the sample size is just 10. So you hide the sample size to blow up your percentage number. So that is not right. So you might do 8 and in the bracket you might write 80%. So that clearly gives an idea to the reader. There were only 8 people and that 80% is coming from only 10 sample size. So give both number as well as the percentages. Check for consistency. Sometimes what happens is that we're writing something in the text, the values do not match with the tables, or the values do not match with the images. So once your paper is complete in writing the first draft, try to check for the consistency in the numbers that has been given in the text, in the tables and the images.